After meticulous planning and loads of preparation, the instruments are ready. The lights are focused. Introducing the Covington Surgery Center, a state-of-the-art outpatient surgical facility right in your own backyard. St. Tammany Parish Hospital, world-class healthcare close to home.
Hello and welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Christian Moises, and with February being American Heart Month, we're here today to talk all about good heart health and how to live a longer life. We're going to be joined by 3 guests throughout this program today to talk about tips and what you can do to lead a healthier life. First up, we have Michael Sanchez, who's a registered nurse with the hospital's cardiac rehab department. Thanks for joining us today.
Thank you for having me, Christian.
You know, with Heart Month, there's a lot of statistics being thrown out there. We're posting a lot on our social media accounts. A lot of it's focusing on Go Red, raising awareness of heart disease with women. But it's not just women that are affected by heart disease and heart attacks and whatnot. I know you want to talk a little bit about heart attacks. So if you want to jump into that, we can start there.
Well, cardiovascular disease, heart attacks, is still the main killer in the United States. About 1 out of 6 deaths in the United States every year are a result of some sort of cardiac event. While women have recently actually started coming up with in their numbers, men are still traditionally have a higher risk of heart attacks at an earlier age. So we've always worked with men, but now we're working with a lot more women as well. One of the things we always like to tell people is just how to recognize a heart attack. I know most people who have heart attacks, they see the movies, they see the traditional person grabs their arm and they grab their chest. Actually, about 70 or 80% of heart attacks that occur are pretty much that's the way they work. You'll get a chest pain, which can be a stabbing pain, a squeezing pain, just a dull pain sometimes in the chest, usually in the middle of the chest, but it can be in other places. And the pain in the left arm is preferentially. We have what's called referred pain. Not everybody has those chest pains. They may have pain in the forehead, the jaws, their teeth actually can hurt sometime, the middle of the throat, the sternum right in the middle of the chest, the right or left arm, and then also there are quite a few people who have it in the lower back. Right. They'll have a back pain that's just different than anything they've ever had before, and that's generally the main sign. So
the left arm is not necessarily a myth, but it's not the only indicator that something's happening.
No, it's not a myth. It definitely happens, but it can be elsewhere. It can be the right arm actually in some cases, but there's a lot of other areas. Some patients, quite a few patients we have actually come in and say they never had any chest pain at all. We had quite a few of our cardiac rehab patients will stress that heavily. I never had chest pain, but they did have it elsewhere. Now, some of the other signs that you'll have is shortness of breath. And I'm not talking just a general shortness of breath. I just ran up a flight of stairs or I ran after my grandchild. You'll have a really severe shortness of breath that just does not want to go away. You feel like you just can't catch your breath. Some of the other symptoms that we have, which are some combination, you'll have nausea. That's more, usually women more than men, but men do have the nausea. Sweating, they'll get diaphoretic. I mean, they'll just completely soak their shirt and their clothes out completely. And then lightheadedness. The lightheadedness usually happens because the heart's impaired in somewhere, they're not getting enough blood flow, they're not getting enough blood pressure up to the brain, so they start feeling a little lightheaded. You can have any combination of those. There are actually people who have none of them, what's called silent heart attacks. So, but like I said, 70 or 80% will get that chest pain and that left arm pain.
Right. You know, something that, talking about myths again and what you just kind of hear on the street, popping aspirin is one of the first things that people say if you start feeling those symptoms. Is that something that you should do? If you start feeling these symptoms, what's the proper course of action?
Well, the first thing we always tell people to do is, because in a heart attack what's happening is the blood supply is getting caught off to the heart. after a while, the heart tissue actually starts dying. So the first thing we always tell people to do before they do anything is just stop whatever you're doing. There's no activity that you're doing that could be that important that you're going to keep doing it. It's going to be worth you dying for. Ideally, sit down, or ideally even lie down if you can. Try to get some rest. Try to get it, because usually what's happening is the heart is being overtaxed because of something you're doing and the blockages you already have. If you sit, lie down, hopefully your heart will be able to catch up. It'll be able to get enough oxygen, and the symptoms will start going away. Now, if you are a heart patient and you have a prescription for nitroglycerin, that's usually where the doctor will tell you to take your nitroglycerin. Take it as the doctor ordered. Usually it's about every 5 minutes, at least 3 doses, and hopefully the pain will go away. The nitroglycerin opens it up, gets that blood going to the heart again. The aspirin, that is something the Heart Association has recommended, that if you take an aspirin, you take one adult aspirin, not an enteric-coated aspirin, just a regular aspirin like some of the usual brand name type aspirin, you chew it up and swallow it, because that can help if there's a blood clot that's causing the problem, can help in that situation. Now there's a little caveat there. If you have any sort of gastrointestinal problems, stomach bleeding, ulcers, or if you're allergic to aspirin, as some people are, you should not take the aspirin. Then at that point, especially if the pain is not going away, you call 911. We always recommend that. You don't call your friend next door. You don't try to drive yourself to the hospital, because that's usually, there's too much of a chance of you losing consciousness and actually wrecking a car, maybe hurting somebody else. So we always recommend you call 911. The emergency medical technicians, the paramedics, they have the equipment they need to diagnose what's actually happening, and they can start the response. They can get the hospital in line and get you set up to where when you get, if you are brought to the hospital, when you get there, we already know what's going on.
Yeah, and I hear that that's something that's somewhat prevalent, which is disturbing in our community, is that a lot of people will tend to drive themselves to the hospital, for fear of having to pay the ambulance ride, insurance costs, whatnot. But like you were saying, it's really important, because once you get on that truck, they can start working on you right there, whereas if you're driving, there's some inherent dangers that can come with that.
Like I said, time is muscle, and they can get the therapies in there that can start getting that blood flow back to your heart. It's the quicker the better and something like that. And one thing I always tell people, a lot of people do not try to call for help because they're embarrassed. They're thinking, it might not be a heart attack. I might be having that reflux, the acid reflux or something, and it's just not. It's better to be embarrassed than to be dead, and that's just the basic bottom line on there.
You've given us some great signs and symptoms and kind of what to do in a pinch if this is happening. One of the things that we'll be talking about later in the program is ways that you can decrease your risks. But with Heart Month, a lot of the stuff that's coming out is how you can measure your own risk on your own time. I know American Heart Association has some great risk factors. We have some on our website. How beneficial is it for you to actually measure kind of where you stand in facing a heart attack?
It can be very, very beneficial. Several of the risk factors that we talk to can be altered. We have a tremendous drop in your heart risk if you can, for instance, some of the things that one of my cohorts is going to be talking about in a little while, what's called the Simple 7. Things like losing weight, stop smoking if you're a smoker. That's an absolute that we try to push to everybody. If you're a diabetic, controlling your blood sugar and everything, it can decrease your risk as much as 40 or 50% that you're going to have an additional problem if you already had one, or if you haven't ever had one. It can actually decrease the risk that you'll ever develop that problem. Right. So,
well, Michael, I appreciate it. Thanks so much.
Thank you. I'm
glad you could be here.
I've been informative.
And when we come back, we'll be talking about those Simple 7 that Michael was just talking about, things that can lead to a healthier lifestyle and a healthier heart.
For the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. We're talking all about American Heart Month, good healthy heart tips, and how to live a longer life. We're now joined by Jan Tridico, who's supervisor of the Heart Center at St. Tammany Parish Hospital. Glad you could be here today, Jan.
Thank you. Glad to be here.
Michael just talked a whole lot about heart attacks and, kind of the bad things that can happen. You're going to talk a little bit about the things that we can do as a community and an individual to maybe kind of prevent those things from happening.
Correct. The American Heart Association has come up with 7 simple steps to have a healthier heart, including getting active, exercise, get up and move. You know, used to we'd say exercise for 30 minutes 3 times a week. Well, we've increased that. The American Heart Association now would say exercise at least most days of the week. So you're looking at 6 days of exercise for 30 minutes.
Right, and they say sometimes even just 20 minutes a day.
Exactly. You've heard this before. Park further out at the grocery store. You know, simple things. Take your dog for a walk.
Right.
I think one of the key factors about exercise is you have to make it fun too. You know, exercise with a buddy. When you're having fun, you know, when we were small, we played leapfrog. You know, we were outside playing hopscotch. As we get older, we forget, you know, to do those fun things. So exercise needs to be fun. Another thing we need to do is control our cholesterol. We know that cholesterol is a major factor in heart disease, in blocking our coronary arteries as well as the other blood vessels in our body. Especially triglycerides. We want those triglycerides to be under 150. That is a form of fat that we see in the body. We want your total cholesterol to be under 200. And then you're happy. That's your HDL. That's the way I always remember it. You know, it's good for that. To be around 50 would be good. And then your lousy cholesterol, we want that low.
I was saying, people, you hear good cholesterol and bad cholesterol.
Right.
What exactly is the
Well,
difference?
you know, the thought is that your happy cholesterol pushes out the lousy cholesterol. So that's why you want your happy cholesterol to be higher. You can increase your HDL cholesterol by exercise. You know, the thought is maybe a few nuts, the healthy oils will help that too.
And healthy eating, which is another one of the
Most definitely. Eat better. Increase your fiber. You know, increase your fruits and vegetables. Another one that leads to is weight loss. We know that a 10-pound weight loss can make a huge difference in your body and your heart.
And it's kind of funny, all these things kind of all go together. It's just living a healthier lifestyle. Michael talked about it. I know you're going to bring it up, and our next guest will probably talk about it too, but quit smoking is one of the big things.
Exactly. You know, smoking, first of all, cigarettes are full of toxins. We know that. It does cause our blood vessels to constrict. So when your blood vessels are constricted, your heart has to pump harder to get the nutrients and the oxygen to the organs that need that. So definitely stopping smoking.
I know there's some other signs that you wanted to talk about.
Reduce your blood sugar. We know that 70% of diabetics will have heart disease. Huge factor in heart disease. And manage your blood pressure. Managing your blood pressure, you know, most people cannot tell if they have high blood pressure. It's called the silent killer. The American Heart Association would like for everyone of all ages blood pressure to be 120/80. You know, that's for, like I said, whether you're 20 or whether you're 80. That 120/80 is optimal.
Is your target. And you know, if you want to measure your own, are the ones that you see at CVS and Walgreens, are those okay to use just to kind of give you a benchmark?
Some of them are accurate and some of them are not, so be careful with that. And to actually diagnose high blood pressure, it is more than one reading being high that you want to look at. And you know, these are the simple 7 is what we work on in cardiac rehab. Cardiac rehab is a team approach. We have physicians, nurses, clinical exercise physiologists, dietitians, pharmacists, who all come together to work on what we call secondary prevention. That means that if we have a patient, most of our patients have had some type of cardiac event before they come to us. We want to work very hard and educate them in lifestyle changes to prevent the second problem from occurring. So it is lifestyle modification. We talk about the diet, the nutrition, the weight loss. We look at the lipid cholesterol levels. we try to also do progressive exercise. That means we start everyone out slowly, and then we progress everyone depending on their heart rate and their blood pressure.
When you have patients come into cardiac rehab, what would you say are the top 1 or 2 concerns or questions that you get from patients?
I think most of them, don't want to exercise. They're scared also. They've had some type of major cardiac event, such as a stent, or open heart surgery, or a valve replacement. I think that one of the things that cardiac rehab does for these patients is it becomes a support group. We actually put our patients in classes, and they get to know other patients who have had problems like they have.
Right.
So it does become a huge support group.
And more information on that can be found on our website, of course.
Most definitely.
But you can also come into the hospital if you need to, and get the support you need.
We're located at the Outpatient Pavilion on Highway 1085, and our number is on the website.
Okay. Jan, did I miss anything? I know it's a whole bunch of information. I know it really all boils down to living a healthier lifestyle. It's things that we hear every day. Some are easier to do than others.
We do know that patients who attend cardiac rehab program can increase their life expectancy by 5 years. That has been proven. We also know that 10 years out, there's a new study that you can increase your quality of life. We're real excited about this information. I do think it comes from knowing that you can change your lifestyle, and it is up to each individual to take control of their life.
So the message today is get to cardiac rehab at St. Tammany Parish Hospital.
Most definitely.
Well, Jan, thanks so much. Thanks. I appreciate it. We're glad you could join us today. And coming up next, we will talk with Dr. Sohail Khan.
They're the movers and the shakers. They're the ones who change our world. And they deserve places designed especially for them, built with kids' specific needs in mind. The latest technology in the caring hands of our dedicated pediatric specialists and primary care physicians, helping kids feel like kids. St. Tammany Parish Hospital, world-class health care for children close to home.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. We're talking all about good heart health today. And to wrap things up, at the end of our program, we have Dr. Sohail Khan, a cardiologist who just recently joined us with Covington Cardiovascular Care at St. Tammany Parish Hospital. A little bit about Dr. Khan. After research work in cardiology at Beth Israel Deaconess Medical Center in Boston and at Columbia University in New York, his path led him to conduct further training at University of Utah in Salt Lake City, Phoenix Heart Center in Arizona, and Louisiana State University Medical Center in Shreveport. Dr. Khan has multiple board certifications in endovascular, cardiovascular, and in internal medicine, and he also has certifications in endocardiography and nuclear medicine. Thank you for joining us today, Dr. Khan.
I'm glad to be here.
The first question I have to ask is, you've kind of been all over the country, so why Louisiana?
Well, my mentor told me one time that I should go somewhere where I'm really needed. And if you look at Louisiana, I don't think it's a proud moment, but we are among top 3 in terms of being the most obese state, the most diabetic, there are more smokers, the more overweight people. So I think being here, I can really help people, I can make a positive impact in their lives. So that's why I chose to come here and practice.
Right. Louisiana historically is at the top or bottom, depending on how you look at it, those list of most unhealthy patients, population, most obese, most diabetic. We're not at the top of any list that we really want to be at.
You'll be surprised that 70% of population in Louisiana are overweight, and almost half of them are obese, which, by the way, is a disease now, just like heart disease. It will kill you at some point.
Yeah, we like to eat. And as you know, we don't eat very healthy down here.
Well, people love football and food here, so I totally understand that, but they need to take care of their heart.
Right. And Jan and Michael were talking a lot about heart attacks and kind of living a healthier lifestyle. From a cardiologist's perspective, what do you see are some of the biggest issues and some of the things that we can be doing as individuals in a community to get on that track to a healthier heart life?
Well, Christian, there is never been a point in human history where people are living in their 80s and 90s. A few hundred years ago, being 80 years old was like a big achievement. Very rarely you will see people, but Nowadays, by making a few healthy choices in your life, few smart choices in your life, you can well live beyond 80s and 90s and be more productive and have good quality of life. All we have to do is to make certain habits in our life and stick with them. So it's pretty possible. And what I tell my patients, there are you see these there are 10 diet books coming every month. There are self-proclaimed exercise gurus. But I think we need to be honest with ourselves and ask ourselves. And again, there are very few rules that you have to follow, 4 to 5. So number one on my list is to attain a normal weight and maintain that normal weight. Now, it is easy. Again, it is a choice. Nobody can forcefully feed us. Right. Nobody can eat for us. It's all about calories in, calories out. So if we are eating less and exercising more and burning more calories, we are going to lose weight, and this is very important. Now, the second habit is to eat a healthy and balanced diet. So it's not only about eating less, but about having a good choice in terms of diet. As the previous speakers talked about, we need to eat more vegetables and lean meat and yogurt,
fiber
and fibers. And again, also about the timing of diet, we need to eat breakfast. Men who skip breakfast, they have a higher rate of heart attack compared to those who don't eat breakfast, and avoid late night eatings. And also we need to avoid 3 poisons in our diet, like for example white poison. I call them white poisons. Like salt, it will increase your blood pressure. Sugar, any sugar-based products like candies and all, and desserts, and then flour, pastas, right, and all that. So so I think we need to avoid those. And then the third most important thing is exercise. Again, it will not only help us to lose weight, but it will make our muscles and joints more agile, make us more flexible. And once we cross in 50s and 60s, it will really help us to keep our balance, will decrease the heart disease, So, right. And then, the fourth habit that I tell my, patients is to get a proper sleep. I mean, that's something that we don't care about sometimes because of watching TV and all that late in the night. But sleeping at least 7 to 8 hours is very important. If you are sleep deprived or sleep deficient for a long time, you will eat more. It creates certain chemical imbalances in your body. You will gain weight. So these are few habits, I think, that if you follow them, I don't see any reason why you can't live longer than 70 and 80 and being right, productive and healthy.
And we heard it from Jan, we heard it from Michael, we're hearing it from
yes,
you. It's things that you
yes,
hear all the time, every day. And
absolutely,
as you were saying about the sleep, it's just a matter of
right,
making the time
exactly,
to do these things,
exactly,
to prevent bad things from happening.
Yep.
And one of the things that you're really focusing on at Covington Cardiovascular Care is peripheral vascular disease.
Right.
I know you want to talk a little bit about
right,
what exactly that is and how you can avoid that.
So this is the disease that most of the patients and even a lot of primary care physicians, they don't pay a lot of attention. But I really want your audience to take this concept that all the blood vessels, in the body, for example, blood vessels in the heart, in the neck, in the brain, in the legs, they have the same anatomy. So the reason we get heart attack is because of atherosclerosis, because when the lipids get deposited in the vessels, they lead to vessel obstruction and then heart attack. So if the same lipid, they get accumulated in the vessels in your legs, or in your neck, in the brain vessels, that can lead to stroke. And if you have those blockages in your leg, that can lead to symptoms like, for example, you may have pain in your leg. And if you are diabetic too, ultimately it will lead to wounds and then unfortunately amputations. So this is the concept we need to be aware of. So what I trained was, I would like to show you an example, a case that I did actually yesterday.
And I think it's on the screen.
Sure.
That's what we're looking at.
So if you look at the screen on the left side, so there's this guy, 70 years old, hardworking guy, very family guy, and He saw my partner because of chest pain. So he asked a few more questions, like, do you get any leg pain when you walk? And the guy said he can't walk more than a few yards. So now this is not quality of life. A lot of people are so focused on the heart, they don't care about other vessels in the body. So my partner did the CT scan. He found these blockages in the main vessels in both legs. It was more on the right side. So if you look at the pictures on the left side, you see this occlusion, this big vessel which gets occluded proximally, and then it comes back distally. So there's about 5 centimeters of blockage. So in the middle screen is a picture where I went through his groin, through a small nick. It was not a major surgery. Nowadays we have excellent technology and devices we can use, and balloons and stents. So I went through the groin and I went in and I fixed the whole blockages in about 30 to 40 minutes. And on the left side of screen you can see that plaque, that junk that I took out of his leg.
Wow.
So now I'm sure that this guy will feel excellent. He'll be walking now. He can exercise, which in the long run will prevent heart attacks.
Right.
So this is something that I'm really interested in, and I want to spread this message to the community. And I have some upcoming talks at YMCA about audience of 100, 200 people about the PAD awareness. So I'll be glad that your audience, if they want to, they're more than welcome to join us.
Absolutely. That's just one of the things that you're doing.
Sure.
You and the team at Covington Cardiovascular Care. You were talking about
Sure.
the lectures at YMCA. We're always out in the community doing stuff. People
Absolutely.
can find that stuff out. Find out about events, whether it's on Facebook, social media, Twitter. We post those things on our website, on our calendar.
Right.
So we're very glad you could join us today.
Sure.
We're glad to have you at Covington
Sure.
Cardiovascular.
Thank you so much.
At St. Tammany. And that's all the time we have for today, but thank you for joining us.